Good evening to all the viewers who are watching live and is watching uh, on a recorded version. Let me just tell you that we have recently got a chance, means got promoted in the joint platform, and we will talk about that later after the CME. So stick till the end to know more about the join button, which we have got right beside the subscribe button. And if you haven't subscribed yet and it's still showing red, just click over there and subscribe for more updates. So without wasting any more time, let's just start our 53rd CME, and we have some waiting features to this start. So with this, let's start.
Good evening, everybody. Good evening, sir.
Good evening.
And we had started from day one. Now this is the 52nd CME online live. And what else? The purpose of National Institute of Homeopathy Alumni Association being headed by our respected president, Dr. Narayan Kalyani, sir, guided by renowned stalwarts like the former director, Dr. Aishwarya Das, and who had given the idea to have the CME on a regular basis. And we are now on the 52nd episode. And tonight we have an excellent topic, very uncommon topic, and which is required by each and every homeopath across this country. So, to introduce on this topic and inaugurate tonight's CME, with your permission, sir, let us bring on Dr. Akashbonti Sonowal, our alumni from DU, to inaugurate and introduce tonight's topic and speakers and moderators.
Sure. Welcome, Akashbonti. Warm welcome.
Over to you, Akashbonti.
Hello, good evening, all doctors, to our 52th online CME Association and Alumni Association. And first of all, I would thank to Dr. D.N. Kalyani sir and Bidyut Mukherjee sir. And I am Dr. Akashbonti, 19 batch. And today's I want to welcome our respected sir, Professor Dr. Avijit C. Burman sir, reader and head of the Department of Forensic Medicine and Toxicology of NIH. Then I want to welcome our speakers. First one, Dr. Aniruddha, that lecturer of Department of Forensic Medicine and Toxicology from Mahesh Bhattacharya Homeopathic Medical College and Hospital, Howrah. And then second speaker one, Dr. Sujata Mandal, from the lecturer of Department of Forensic Medicine and Toxicology from Bengal Homeopathic Medical College and Hospital, Asansol. And today's topics are very interesting topic. First one, medical legal aspect as a homeopath must follow. And second one is Consumer Protection Act and its binding on a homeopath. That the two topics are very interesting. That the first topic as a medical legal aspect of that I want to share, I want to tell that no doctor treat a patient to kill, but if we know that all medical legal aspects, then we can we should know that all medical legal aspects. And the next that our uh, main that case taking portion is the main portion that we should know all, starting from introduction to investigation, and that prescribe a medicine. Since then we should proper know all the things, otherwise civil negligence or criminal negligence will come someday. And the next topic is Consumer Protection Act, and is binding on a homeopath. Especially that is it is a it rise for of a patient, about their safety, about their consent, about their confidentiality, etc., etc. And our speakers, today's speakers, will say nicely to on these topics. And thank you for added me this CME as inaugurator. And now I want to hand over to Dr. Bidyut Mukherjee sir.
Thank you, Dr. Akash, and so nice of you. And what we are intending to go give this platform mileage, like it's a continuous education program, and we have a beloved friend, philosopher, and a guide who will be the judge moderator tonight to guide both the speakers and to give his views. What a homeopath must follow on medical legal aspects. There are a lot of avenues, and it has not been taught. It has been taught on a very limited period of time during the FMT part of the VHMS course. So I'll request Sir to permit Avijit to take over the dais and conduct the CME tonight. Sir, over to Avijit, Professor
Uh,
Avijit Burman.
Thank you so much, Dr. Bidyut Mukherjee. Uh, I'm really honored uh, to be here today in front of you all to share my views and to be the moderator of this today's 52nd CME on medical legal aspects, covering medical legal aspects as well as CPA or Consumer Protection Act. I'm really thankful to the organizers, mainly Dr. My most respected Dada, Dr. D.N. Kalyani, and to my most very cherished and most beloved friends, Dr. Bidyut Mukherjee, Dr. Pralay Sharma, and so many. Thank you, all of you. Without wasting much of time, let us start today's program. First, I would like to request Dr. Aniruddha Nag to start the proceedings on his deliberations on medical legal aspects, which a homeopath must follow and should know. Dr. Aniruddha, please start your lecture.
Yeah, thank you very much, sir. Uh, Before beginning, I must say I'm really very much thankful to the organizer for giving me such an opportunity. And maybe if I would not have taken up this work, I would have not known a vast uh, unknown arena which this topic is covering. Being a homeopath, we really um, don't pay heed to those minute details which may land up in trouble. And we must now this high time we must be alert and should concentrate on this matter. Okay, now medical legal aspects a homeopath must follow. Now, you all know that we are at first a physician, because in the organon of medicine, already our master has said the physician's high and only mission is to restore the sick to health, to cure, as it is termed. That means he has not mentioned a homeopath, a homeopath's high and only mission. He has mentioned the term physician. That means we are a part of our healthcare system. We are at first a physician. Then comes our system, be it allopathy, be it homeopathy, or it's Ayurveda. So, we being the practitioners of the homeopathic medicine are not out of the arena of the medical jurisprudence. Uh, I think everybody are familiar with the term medical jurisprudence. And as we are dealing with the health and life of the people in the society, because we are not dealing with any such machines, like we are not dealing with refrigerators, we are not dealing with vehicles, we are dealing with the human life. And so we are bound to be guided and guarded by definite codes, ethics, and legislations. And this we must follow. So for that, we know that we are taking admission into the BHMS course. We are studying homeopathy to be a good homeopathic doctor. Now, what is our prime motto? To pass out and to set up our own clinic and start our practice, because many of us are into the government service, but as we all know that the government service is very rare, and so the majority of our fraternity goes for the private practice. So for that we set up our own clinic. And for that, what are the medico legal aspects of setting up of a clinic? And for that, we must know about the Clinical Establishment Act. So, what is Clinical Establishment Act? Before that, what is clinical establishment? So, the clinical establishment means a hospital, maternity home, nursing home, dispensary, clinic, sanatorium, or an institution by whatever name called that offers services, facilities requiring diagnosis, treatment, or care for illness, injury, deformity, abnormality, or pregnancy in any recognized system of medicine. In any recognized system of medicine. Here, this line has to be noted down. It's not specifying about allopathy or homeopathy. In any recognized system of medicine. In our country, uh, allopathy, and along with allopathy, uh, now the term modern medicine is being used. The Ayush system is being recognized by the government of India. What is clinical establishment license? A clinical establishment license is the registration of a clinical establishment, hospital, nursing home, diagnostic center, or a single doctor clinic, that means the private clinic, by the government. So we must obtain the proper registration. The registering authority who provides the license facilities, policy formulation, resource allocation, and determines standards of treatments. So all this is determined by the registering authority, and we must abide by this. Excuse me. Slides are not coming. There is some technical error. My slides are not showing up. Slide 3, 4, 5, 6. Can anybody?
Sir, I guess there is some problem with the network, with your network, I suppose.
Yeah, the slides are not showing up. Okay, leave it.
Or
I'm
maybe,
just
sir, the slides may have not been uploaded properly.
no. It's there in my drive. It's
No,
there.
sir.
Wait,
You have to upload. I told you previously that you have to upload it over here. So that's why.
oh, wait again.
Can you just re-upload the slides if possible?
Yeah, yeah, yeah. I'm re-uploading it.
It will be best, sir. So just removing it for now. Removing this slide from now. Audience, please just hold on. To everyone, please just hold on. Sir is getting ready.
Remove from studio. Okay. Actually, due to rain, I'm having a severe network issue. Uh, it's getting very slow. The upload.
Okay, sir. You just continue with
Yeah,
some of
just
your
bear with me.
topic.
Yeah, yeah.
Mhm. Audience, just please wait for now, if possible. Just please wait.
It's showing processing. I think.
Sir, it
Yeah,
will take time. Just hold on. It will take time.
yeah, yeah, yeah. I
Since you have
got it.
network issues, so it will take time, sir. Please just hold on.
Yeah, I think it got uploaded. Yeah,
It's uploaded now.
yeah, yeah.
Continue, sir. Over to you.
So we did away with the clinical establishment license. Now, what is Clinical Establishment Act? Actually, it's the act formulated by the government of India. Okay, so what does it say? The Clinical Establishment Act, it was amended in the year of 2010, has been enacted by the central government to provide for registration and regulation of all clinical establishments in the country with a view to prescribe the minimum standards of facilities and services provided by them. That means we have to maintain a minimum standard in our clinic. And the aim of this act is to register all clinical establishments in India to make it easier to regulate them and implement standard practices, with the exception of the establishment under the military forces. The military forces do not come under this, and all public and private establishments, including Ayush. I have written this in bold. That means Ayush is also included under this act, including Ayush establishments, are required to register. Okay, so it's not like that कि okay, I have passed, चलो एक clinic खोल लिए बैठ गए कहीं पर भी. No, this should not be done. In case of our state West Bengal, we come under the Clinical Establishment Act, known as the West Bengal Clinical Establishments. Act 2017. It extends to the whole of the state of West Bengal, and it shall come into force on such date as the state government may, by notification in the official gazette, appoint. Now, regarding this Clinical Establishment Act, there are certain policies. Okay, there are certain rules and regulations. That means your room must be of certain size. There must be specific place for the patients to wait. There must be a separate waiting room. There must be separate toilet facilities. So few of them are not very practical. That means in a city like Kolkata, uh, to arrange for such a huge space, it's really challenging in case of monetary term, and also in case of place, because it's such a huge city and a congested one. So there we must stick to mane, we must stick how much that is possible for us. Okay. Now, after setting up of the clinic, what is the first thing that comes to our mind? That is, the clinic must have a proper display board or the signboard. So, what is to be written in signboard? First, the name of the clinic, then the name of the doctor, and it should be legitimate, and the name must be written in full rather than using the initials. The prefix doctor should be written as capital D small r and not as capital D and capital R, which most of us make mistake. Only the qualification and degree which is recognized by the government of India must be displayed. I may have n number of qualifications, I may have n number of degrees, but out of that, suppose only two are being recognized by the government of India. So there I should not use the other degrees, okay, for the display. I must only display the degrees and qualifications which is being recognized by the government of India. When we must be very careful about that. Physician possessing specialized degree in a particular subject should only mention about it. Otherwise, use of the term specialist in an ambiguous manner must be avoided. This is the problem with us homeopaths. We often tend to write specialist in skin diseases, specialist in chronic diseases. I think you all must have come across such signboards or some advertisements in the paper, or some cards. Specialist in chronic diseases, specialist in skin diseases, specialist in gynecological disorders. No, we are not specialist in those subjects. We have our post graduation specialization only in 7 subjects, and out of that, the 2 subjects like practice of medicine, that is also a general subject, and pediatrics and psychiatry, these 2 subjects are we can write consultant homeopathic psychiatrist, consultant homeopathic pediatrician, or specialist in pediatric diseases, and specialist in psychiatric diseases. Otherwise, we are not entitled to write specialist in other subjects like gynecology or dermatology, and so and so. Okay, so we must keep this in mind, because if anybody challenges us, then we must end up in trouble. The university awarding the degree must be recognized one by this. Previously, it was CCH, now it's NCH, and only the name of the university must be mentioned beside the degree in bracket. Often, especially those people like us who pass out from the National Institute of Homeopathy, we all often tend to write beside our degree like BHMS, NIH, Government of India, MD, NIH, Government of India. No, because NIH is not giving us the degree. Our degree is being awarded by the previously it was University of Calcutta, now it's the West Bengal University of Health Sciences. So the degree from where we are obtaining, that should be mentioned. That means if I write BHMS, we must write WBUHS, not NIH Government of India. If at all I want to mention the name of National Institute of Homeopathy, then we must write it below the degree, like ex scholar of the National Institute of Homeopathy or ex intern of the National Institute of Homeopathy, Government of India. And if possible, the registration number from the respective central council or the state council must be displayed. Now here in this slide you can see the common mistakes in the signboard. The things which I told just now, I have written it and have showed what is the incorrect way and what is the correct alternative. Now often we find out in our clinics, in many doctors use CCTVs in the clinics. So if at all CCTVs are installed, it should be clearly displayed in form of written notice. There must be large notice reading you are under CCTV surveillance. Otherwise you don't have any right to watch the whereabouts of your patient, what they are doing. So by writing this, you are under CCTV surveillance. In a way, you are just alerting them and you are obtaining the consent in a passive manner. So this must always be written. You are under CCTV surveillance. Now coming to the consultation fees. The consultation fees must be reasonable and uniform for all the patients, irrespective of age, sex, religion, color, and creed. There should not be any discrimination. It is advisable not to display the consultation fees publicly, but at any suitable place within the clinic to maintain the transparency. The consultation fees need not be mentioned in the signboard, okay, outside, but within the clinic at a suitable place, there it can be mentioned. So this leads to the transparency. There should be no hidden charges. Any extra charges like price of the medicine, etc., etc., must be clearly mentioned, and the patient must be made aware of that. Patient should be given the liberty to decide about the procurement of medicines, must not be forced to buy the medicines from the doctor. Okay, we homeopath often serve our own prescriptions. Okay, so we must not force the patient. We must leave that at patient's will, from where he or she will take the medicine. The medical ethics and etiquettes must be maintained. What is medical ethics? The code of laws which guide us in dealing with the patients, and etiquettes, the code of laws which guides us in dealing with our same fellow members, the same persons belonging to the same fraternity. So the medical ethics and etiquettes must be maintained by the physician regarding charging of fees. The fees can be waived off for economically weaker sections and members of the same fraternity. It can be medical, paramedical personnels. Now, what are the precautions during examination of the patient? Examination of female patients must be done in presence of a female attendant and vice versa. Now, here I must mention that the male physicians must be much more careful about this, because male physicians are at a higher risk of getting trapped, as 49 laws are women centric in our country. So, the male must be much more careful. In the absence of proper attendant of the opposite sex, the patient must be examined in presence of the person accompanying the patient with his or her consent, preferably in written format, and his or her relationship with the patient must be duly noted down and must be signed by him or her. In the absence of both attendant and the accompanying person, what to do if there is if the patient is alone, he or she has not brought any attendant with him or her, and also there is no uh, attendant present in the clinic. So in that case, the physician must refrain from examining the patient, and if at all the physician has to examine the patient, then he or she must do so only after obtaining a proper and clear written consent from the patient bearing his or her signature. This is very important. Now, about attendant. One must also be very cautious about selection of the attendant. The attendant must be preferably of a middle-aged group and must possess a minimum qualification. The detailed identity of the attendant must be obtained before hiring, and a copy of the identity card must be kept for further records. The local authority may also be kept informed regarding this. Now, coming to the professional secrecy. These terms all we are well aware of because we all have studied these terms in our forensic medicine and toxicology subject. So, no information about the nature of illness or personal history or past history or private life of the patient who is an adult should be disclosed without his or her consent. If the patient is a minor one, then the guardian may be disclosed about the nature of illness. Otherwise, if the patient is adult, then it must not be disclosed without his or her consent until and unless demanded by the court of law or for the sake of larger benefit of the society, as in cases of severely infectious diseases, like if the person is suffering from AIDS or other sexually transmitted diseases. Now it's the period of pandemic COVID, so epidemics, pandemics, insanity, etc. There you can reveal. If you are willing to publish the case record, many of us are very successful in our clinics. We maintain the records, we maintain the database, and we are very enthusiastic to publish those records in the leading journals. So if at all the case records needs to be published for any journal, the original name of the patient must be kept concealed. And if at all the original name is used, that must be done with the written consent of the patient. The photographs of the patient must not be published without his or her consent. When published, the face should be kept concealed. While undertaking any clinical research work, the patients must be informed duly and consent must be obtained in written. Now, the most important part, serving of prescription, which is the weakest point in our homeopathic profession, because vast majority of persons in our fraternity, we refrain from serving the prescriptions, and this is a very very blunder in the eyes of the law. Okay, so this is one aspect where most of the homeopaths are at fault, as they do not serve prescription. We fail to realize that prescription is a legal document and every patient has the right to get prescription from his or her physician. This is the right of the patient. If the patient demands Patient can in fact go to the court of law and challenge if you don't serve the prescription. Now, what to write, what not to write, how to serve. Some of the key elements that every prescription should contain. First, the details pertaining to the physician's doctor's full name, which has to be printed on the letterhead prefixed by capital D, small r. Again, not capital D, capital R. Next, in the letterhead, you have to write doctor's details such as the address of the clinic, consultation timings, telephone or contact number, along with the email. Email is optional and it should be printed on the letterhead, as I told. Doctor's primary qualification along with additional qualifications, only the qualifications, additional qualifications which are recognized by the universities of India or the government of India, that should be written. Doctor's registration number, very, very important, and the registering authority. That means if I am registered with the West Bengal Council of Homeopathic Medicine, then I must write my registration number, whatever it may be, suppose 28588. Then I must mention Council of West Bengal Medicine beside the registration number. Then doctor's full signature at the end of the prescription, doctor's full signature and date, both in blue indelible ink, has to be written. This is required to verify the authenticity of prescription in order to prevent misuse. Now here, one thing, uh, I have written it in my subsequent slides. The color of the ink in the letterhead, and often we tend to use variety of colors, purple, green. Only the red color has to be used, or the blue color has to be used. Otherwise, no other color is to be used because those are not allowed. Date of prescribing, at what date I am prescribing, it is a very, very much legal requirement. And we must also use the stamp, doctor's rubber stamp. What it contains: first line, full name of the physician; second line, qualifications; third line, consulting specialty, whether you are a general physician, whether you are a registered medical practitioner, whether you are a consultant homeopath, consultant Ayurvedacharya, consultant Unani, consultant gynecologist. So this has to be mentioned. And then registration number below at the last. Now, what to write in the body of the prescription? We have to divide the whole prescription imaginarily into three parts: left hand side, middle, and the right side. So in the middle part, at the top, we have to write about the details pertaining to the patient. And what are those? Patient's full name, patient's age, weight, patient's address and contact number, sex, and this should be preferably handwritten rather than printed. Now, details pertaining to the disease condition. The present complaints must be noted down on the right hand top side, and based on the pathognomonic symptoms, the provisional diagnosis should always be noted down with a query or triangle sign, which most of us forget. We get so much engrossed in taking the case and finding out the homeopathic remedy that we forget to mention about the diagnosis. And this is a very, very much blunder from the medico legal point of view. The diagnosis must always be mentioned. It maybe my diagnosis is wrong, maybe it is not accurate, maybe I'm not coming to a particular diagnosis, I have 2 to 3 diseases in my mind. Whatever comes to my mind, I must note it down with a question mark or with a triangle sign. So if the physician is not sure of the diagnosis, he may write down 2 or 3 disease conditions with a query or question mark and must advise for the suitable investigations. Next, what we most homeopaths don't do, we just have a verbal communication with our patients. We refrain from touching the patient, right? But this should not be done. We must examine the patient. The findings on examination of the patient must be noted down meticulously. And the most important, the findings on anemia, clubbing, jaundice, cyanosis, and edema, which we never do. We have learned this uh, in our internship days, in our allopath, when we were doing our internship in the allopathic hospitals. But still, after passing out, we just ignore these things, or rather forget about mentioning these anemia, clubbing, jaundice, cyanosis, and edema, which is again a blunder. Then relevant examinations after these findings, if anemia is negative or positive, clubbing is negative or positive, jaundice, cyanosis, and edema, then we must write down the findings of the relevant examinations pertaining to the system. Suppose if a patient is presenting with a symptom of the cardiovascular system, so we must measure the BP and we must note it down. We must auscultate the chest of the patient and note down our findings about the heart sounds. This must be done. Next, in the main part, details pertaining to the medicines. That means in the middle part, what we should write? We should write the name of the medicine, which must be legitimate, and it can be very much well read. The person who will serve the medicine, he or she must be able to read the name of the medicine. You can write the common name, but it has to be approved common name may be used. Next, the strength or potency of the medicine. Dosage form should be mentioned clearly, like whether it should be given in globules or liquid or tablets. Total quantity must be mentioned, and then the dosage and dosing instructions. We all are very much aware of the parts of the prescription. We have all learned it in our pharmacy classes, so I'm not going into that detail. What is the superscription, inscription, those blah blah, I'm not going about this. I'm just hinting at the medico legal importance. If the doctor wants the prescription to be dispensed only once, he should clearly write that do not dispense more than once or do not dispense unless instructed. We homeopaths always argue, if we serve prescription, the patient will buy self-medicate, buy the medicine on his or her own and start to take medicine. So there is a way out. We have to write, do not, in bold, do not dispense medicine more than once or do not dispense unless instructed at the bottom of the prescription. This is very important to deter patients from repurchasing the same prescription again and again unless so directed by the doctor. Now, details pertaining to the advice to the patient. Apart from writing the remedy or apart from giving the remedy, one more important task has to be accomplished. That is the advice, and it has to be written in the left hand side. So, this advice to the patient must be covered under the following two headings: advice regarding diet, regimen, exercises, lifestyle modification, etc. This must be given in written form and also must be explained clearly to the patient. I have explained it to the patient and have not documented in the prescription, it won't do. Again, I have documented in the prescription but has not explained to the patient. Again, that is a mistake. Both we must do. Next, advice regarding proper investigations based on the pathognomonic symptoms. Here, we must be very careful and we must avoid advice of unnecessary and irrelevant investigations. This has to be very much taken care of. Okay, we always have the habit of giving investigations from A to Z, right? From the starting from the complete blood count and so and so, we go on giving advising investigations. No, only the relevant investigations pertaining to the system, pertaining to the present complaint has to be advised. Thirdly, if any emergency condition is suspected, we must always refer the patient on written along with signature and mention of date and time of seeing the patient. Okay, so we must not refrain from referring. And if I suspect any serious condition, we must mention that on the prescription in writing, putting the date and the time of attending the patient and along with the signature. Now, some important points to remember: do's and don'ts. Do not serve any prescription without personally attending the patient. Many a times we come across the attendants or the relatives of the patient or the friends of the patient coming and asking for the remedy for her for his or her father, mother, sister, brother. So we must not serve the prescription without personally attending the patient. If at all it is required, a note must be written at the top: patient not seen or attended personally, prescribed on the basis of the symptoms, narrated by so and so person, and then write the relationship and get it duly signed by the person who has come to take the medicine. Blank prescription should be kept in secure places to avoid misuse. Overwriting on a prescription should be avoided. Very, very important. In case of overwriting, doctor must initial each correction. The color of the writing in the letterhead, as I already told, should preferably be in blue or red. No other color is to be used. And one more important thing: the red cross, often in the prescription, now nobody, very few people use, but previously almost everybody used to use the symbol red cross. It should not be used because it is the property of the International Red Cross Society. We have our own symbols. That symbol can be used. Prescription may be typed, computer generated, but it has to be signed and dated by doctor in blue indelible ink. It is illegal to allow nurses assistants to write prescriptions or medication orders. No, they should not write it. One should avoid having names of two or more doctors on the same prescription pad. Yeah, we come across it very often. Husband and wife are doctors, and both of their names are written on the same prescription. So it's clearly written if it is, even if it is a husband and wife team. More so if they belong to different specialties or systems of medicine. Even if they belong to different specialties, then also it should not be written. It is unethical for a doctor to prescribe medicine for his own use other than the simplest over the counter medicines. Self medication as a concept is to be discouraged. A doctor should not use another doctor's prescription pad even with his consent. Conversely, a doctor should not allow another doctor to use his or her prescription pad. Very important. Now, another very important mistake which we tend to do, we often write SOS. So, SOS against any medicine should never be written as it is not an accepted abbreviation. SO is not an accepted abbreviation. The accepted abbreviation is PRN, pro re nata, or the English equivalent as and when required. That too, in such cases, the minimum dose interval, the maximum daily dose, and maximum duration and maximum quantities to be dispensed should be specified clearly. Another very important point which we all make mistake, the case history of the patient must never be noted on the prescription. You can write about the main symptoms, the main presenting complaints, but the detailed case history should never be noted down on the prescription. This should be noted at a different place. You can keep your own diary, you can keep your own register, or your own database. You can keep the record in a soft copy form in your mobile, in your laptop. So this should be noted at a different place and must be kept safely with the physician for future reference. One must be doubly careful in writing the potency and quantity of the prescribed medicine. It is advisable to write the quantity in words also, so that patients' clients do not manipulate the numbers. And very, very important, one should refrain from prescribing medicines of the other systems of medicine. There is a clear cut verdict of the Supreme Court regarding this. This I have already told, must refer the patient to as and when required. Now, do I have some time? Then I shall discuss about the certificates. Certificate slides, I don't have, only two slides I shall discuss in orally, verbally. So if I have time, then I shall discuss. Otherwise, I would request Avijit sir to say about the certificates. Do I have the time? Okay. So medical legal aspects of giving certificates. I am not going into detail about how to write certificate, because this has been taught. If most of us know it, it has been taught in our BHMS curriculum in the subjects of forensic medicine and toxicology, and also in community medicine. We all have been taught regarding this. The common mistakes we do while giving the certificates, only I shall touch only those points. Suppose in case of fit certificates, we often tend to write that the patient was suffering from so and so disease from so and so date. No, we must issue the certificate for the period under which the patient was under my treatment. Suppose I have seen the patient on 5th of July 2022, then I must write in the fit certificate that so and so patient, a resident of so and so. There also we must, another mistake we often tend to do while writing the address of the patient or the subject, we often don't mention about the police station. The police station must always be mentioned. So, so and so patient residing in so and so aged, etc., etc., was under my treatment, was suffering from so and so disease, and was under my treatment from 5th of July 2022. He or she is now fit to resume her daily activities. So, this has to be very much taken care of. Now, in the sickness certificate, uh, while advising the patient on the prescription, we advise rest for few days. So what is the maximum period of rest? How many days we can prescribe? If I am a general physician without any postgraduate degree, then I can only advise rest for a maximum of 7 days. Often we tend to advise rest for 14, 20, for months. No, that is not to be done. That is a blunder. If I am a graduate doctor, then maximum I can advise rest for a period of 7 days, until and unless the disease is of such character, like if it's a case of fracture, then then it's not our case. Orthopedic surgeon will attend. Suppose in case of typhoid, where 12 to 14 days of rest is required, because the Vidal test is only coming after the 7 days. So, COVID initially it was 21 days, then 14 days, then 10 days. So, until and unless it is disease specified, uh, we should not advise rest more than a period of 7 days. But if I am a specialist, be it in any system of medicine, if I am having a postgraduate degree, then I can judge the situation, and then I can advise rest for suppose 14 days, 20 days, only if I am a postgraduate doctor. Then, in case of death certificates, if the death is sudden, unnatural, suspicious, and unidentified, never issue a death certificate. We must not issue death certificate if the death is sudden, unnatural, suspicious, and unidentified. Then there it is our duty to first notify the local police station about the death. If at all, if at all we are bound to give death certificate under any threat, then we must adopt two tricks here. We can write the death certificate in an ambiguous way, or some in incorrect format, so that it gets cancelled at the site of the crematorium, because the doctor, the registrar at the crematorium, they're also a person, they issue the death certificates. So we can get away with that. And number two, we must immediately inform the local police station that so and so death has occurred, and I have been compelled to give death certificate under threat. So there are lots and lots legal aspects regarding this certificate, which needs to be discussed. I think now it's my time is over, and with this I end my session. And before ending, I must thank my teacher of National Institute of Homeopathy, Professor Dr. Avijit Burman, because without his guidance, without his help, I would not have presented this topic today. And I'm really, really thankful to Sir, because he took the pain of, he spared his time and took the pain to explain me each and every detail regarding the medical legal aspects. And I was astounded. Many things which are not aware of and which we don't know, where we can end up in trouble. So thank you, sir. Thanks to Bidyut sir, Kalyani sir, and all the seniors present over here for giving me an opportunity to speak on this important, otherwise neglected topic. And that's all from my side today. Good night.
Hello. Uh, am I audible? Can you hear? All of you can hear me? Thank you, Dr. Aniruddha, for giving a very, very detailed and nice lecture on this topic of medical legal aspects a homeopath must follow. Regarding this, he has touched almost every detail which we use to do mistakes on certain grounds. But I would like to clarify a little bit regarding he has whatever he has pointed out. I would like to highlight those things. Those who are my respected listeners, or those who are participating in this webinar, please note it regarding the consent. It is very, very important regarding taking consent. It may be verbal consent, it may be implied consent, and in certain places these are obviously and mandatorily, it should be a written consent taken from the patient. Second is a legitimate prescription writing, as Dr. Aniruddha Nag had clearly described. Please maintain, first of all, you should provide a prescription. Whatever fees you are charging, it may be 1 rupee, it may be 1000 rupees, doesn't matter. But providing a legitimate, a valid prescription is mandatory on our part. This is a blunder mistake we do at many times. And the prescription must also be in a proper way that should be served. Only mentioning the name of the medicine, writing the name of the medicine will not suffice. There are certain so many things which Dr. Nag had clearly described in his deliberation. Please take care of those things and try to note down those things before serving the prescription to the patient. Next, coming to the investigations, we homeopaths, we being homeopaths, we usually refrain. We have a not, we are not very conscious. We do not come forward to write prescriptions, write investigations for patients. Relevant investigation writing, advising the patient to go for certain relevant investigations are also very important. Without doing all those investigations, you cannot come to the final conclusion of your diagnosis. Provisional diagnosis you can do on the very first day, but confirmatory diagnosis may not be achieved on the very first day, but that should be done as early as possible and written according to the uh, uh, investigation report received on subsequent days of the visit of the patient. This is important. Please maintain the documents on subsequent visits. That means the second day, third visit, fourth visit, etc., etc. onwards. We do not usually write what are the findings. We simply write down. We have a habit of writing down the prescription only, the medicines names only, name and potency, etc., etc. But on the left hand side, do not forget to write down in brief at least what are the condition of the patient. After seeing or examining your patient on the very first day, what is the change? What are the changes rather? Individually, you should write down whether they are improved or not improved or worsened, whatever it may be. You should write in brief on the left hand side and then put your prescription for the second day or third day. Referral service, it is one of the most important service of a registered medical practitioner or a general physician. Referring to the patient at the right time to the right person is also our mandatory duty. At most of the time, it's sorry to say, I'm really sorry to say, we think that if I refer a patient to a person or a specialist, that is our disgrace. No, not at all. That is not our disgrace. I cannot be a master in everything. I'm a general physician. I'm looking at almost all the diseases from head to foot. I may not be a specialist. I do not have any mastery in certain cases, in all the cases. So referring patients to the specialist or specialist doctor at right time, don't delay in referring. At the right time is also very, very important medico-legally. This you should keep it in mind. Next, coming to the FIT certificate, Dr. Aniruddha had mentioned regarding the FIT certificates. Yes, regarding the FIT certificate, one point he probably missed out unnoticedly, that I should clarify and keep it in. You should keep it in mind when we write the person. He is fit to resume, or she is fit to resume his or her normal regular activities on and from tomorrow. That is, suppose I am issuing the certificate today, that is 10th of July. He is fit to resume his normal duties on and from tomorrow, that is 11th of July. This is also wrong and incorrect in the eyes of law. Fit means both mental and physical fitness. I am not a psychiatrist. I cannot take charge of the mental fitness of my patient. No. Though I am treating all sorts of physical ailments, we are taking mental symptoms, etc., etc. But while issuing a certificate, a general physician should write he or she is physically fit. Be careful in mentioning the word physically. Don't write simply fit. Simply, if you write fit, it includes both mental fitness and physical fitness. You cannot take charge, you are not responsible for the mental fitness of your patient. Please take it, take this or note this point and keep it in your mind. Whenever you are issuing a fit certificate, please mention the word is physically fit to resume his or her normal duties on and from tomorrow. Then time, time for rest. Dr. Aniruddha has mentioned 7 days. Yes, it is very much 7 days, but under special circumstances, he was giving a few of the examples. Under special circumstances, if you have a valid documentary evidence in your hand, you can extend. That means an undergraduate doctor, a BHMS doctor, can extend that period of rest to 3 more days. That means 7 plus 3, that is 10 days. But that is the ultimate limit. Please don't exceed that limit. Keep this in mind and don't exceed that limit. There are a lot of cases where the patient will require more rest. In that case, he or she has to attend and take the certificate from a specialist. A postgraduate doctor in a certain specific discipline can issue a certificate of fitness for 14 days. He also has got that privilege of 7 plus 3 days. That means after 14, initially by a undergraduate doctor and thereafter by a postgraduate holder, he can give the rest, or the time period of rest can be 14 and can be added up or extended up to 6 more days, that 20 days. That is 20 days. Beyond that limit, if a patient requires, and under certain cases, special cases, rest for more than 20 days, in that case, two doctors having postgraduate qualifications must agree and sign the document. And in that case, obviously, you can understand a doctor attending in his own clinic is not being able to do that. In that case, the patient has to go for an institutional treatment. In that case, on a hospital or a nursing home, he can or she can get that certificate. So there are certain exceptions. For example, Aniruddha as mentioned, in case of a fracture, suppose a fracture has got occurred. In that case, a normal fracture healing takes time of 6 to 8 weeks. An orthopedic surgeon can advise the rest for 6 to 8 weeks directly for his or her patient, and which can be extended under special circumstances. But being a homeopath, first of all, a graduate homeopath having BHMS degree, we should refrain ourselves from giving rest to our patients for more than 7 days. Under special circumstances, that can be extended up to 10 days. Please keep this in mind. And there had been a case in recently which has occurred. There, the court verdict is in favor of us. Those who are having postgraduate MD home degree, they are permitted to give rest, and they will enjoy all the privileges. The court has given the order in that form. They will enjoy all the privileges which a postgraduate allopathic doctor or the doctor from the modern medicine enjoys. So similarly, he or she can advise rest for 14 plus 6, that means 20 days also, but not beyond that. Please keep it in mind what is your qualification and give the period of rest accordingly. And then coming to the death certificates, the last point regarding the death certificate, probably Aniruddha, due to hurry, we had missed out these 2 points. Previously, what we used to see in our school days or college days, earlier college days, this amendment, this change has come. This has come into play recently. Hardly, I am not very sure regarding the time period, regarding the year of amendment. Probably 10, 12 years have passed by this time. where you are supposed to mention previously what our predecessors used to write. So and so person expired on so and so date due to cardiorespiratory failure. This has been amended. If each and every patient is dying due to cardiorespiratory failure, what will be the condition of the medical records? The authority, the state health authority or the national central health authority will be at a totally dark. What are the disease conditions which the patient is suffering from? In that case, what the amendment speaks, the amendment speaks like this, that you are supposed to mention the primary cause of disease. Primary cause of disease matlab means what the patient was suffering from. The patient might be suffering from hypertension, diabetes, malignancies, carcinoma, etc., etc. That has to be mentioned, and this is the primary cause of disease, cause of death. That has to be mentioned. The patient was suffering, who was suffering from so and so and so diseases. There may be multiple diseases, no problem regarding that. You can mention easily. To due to here also one amendment due to just I'm going back to the definition of death. What it goes like this. Mention due to cardiorespiratory failure, I'm ignoring the central nervous system, so I cannot do that. So in that case, it is the amendment has been made in this fashion that it should be mentioned as died due to neurocardiorespiratory failure. Died due to neurocardiorespiratory failure. So the two amendments, please take it to take it, note it down. Expired on so and so date, who was suffering from so and so diseases. Please mention the names of the diseases, and died today, suppose today, 10th of July at 5 o'clock, 5 p.m., etc., etc., on so and so place, at so and so place, due to neurocardiorespiratory failure. This word of neuro has been added. Please mention it in your death certificate. This much to add, nothing more regarding the first topic. I'm extremely thankful and congratulate Dr. Aniruddha Nag for giving a very nice and detailed, thorough description and deliberation regarding this topic. I think all of you are quite happy and will be enriched by his oration. Thank you once again, Dr. Aniruddha Nag. Let me call our next speaker, Dr. Sanjukta Mandal, to speak on his topic of CPA, that is Consumer Protection Act. Dr. Sanjukta.
Thank you, Dr. Hello? Hello, am I audible?
Yes, ma'am, you are audible.
Okay, thank you. Thank you, Dr. Avijit Shee Burman, sir, for introducing me. A very warm good evening to all my respected teachers, seniors, and my dear colleagues. I thank each and everyone for being here with us today. Today, I will try to enlighten on the topic Consumer Protection Act and its bindings on a homeopath. So, a question may arise as why medical services come under the Consumer Protection Act. So, we have to understand that we as homeopaths, or rather medical practitioners, are delivering a kind of service towards our patients by treating them, by curing them, giving them all sorts of advice regarding management, regarding their prognosis. All such advices are given by us. So this is a kind of service that we are providing, and thus all all the medical fraternity, they have to abide by the Consumer Protection Act. And here we have to remember that the consumer here is our patients, and we as doctors are employees. Till the time we are delivering our service to them. The doctor-patient relationship is thus a contract of service. To understand the bindings of a homeopath, rather the whole
Sorry
medical
to interrupt, ma'am.
fraternity, we first have to
Ma'am,
have a
sorry to
general
interrupt.
overview.
Ma'am, sorry to interrupt in between, but are you changing slides or something, ma'am?
No, I have not changed the slides yet.
Oh,
As
sorry, ma'am. Sorry to interrupt again.
okay, it's okay. To understand the
Over to you.
bindings of a homeopath, rather the whole medical fraternity, we first have to have a general overview as what is this Consumer Protection Act. This is an act to provide for the protection of the interest of consumers and for the said purpose to establish authorities for timely and effective administration and settlement of consumers' disputes and for matters connected therewith and incidental thereto. So this is an act that is made to protect the interest of the consumers. This act extends to the whole of India except the state of Jammu Kashmir, and this act shall apply to all goods and services except otherwise expressly provided by the central government by notification. This act has been put by the central government of India. Now, who is a consumer? A consumer is any person who buys any goods for a consideration which has been paid or promised or partly paid and partly promised or under any system of deferred payment and includes any user of such goods other than the person who buys such goods for consideration paid or promised or partly paid or partly promised or under any system of deferred payment when such use is made with the approval of such person but does not include a person who obtains such good for resale for any commercial purpose. So the to sum up, a consumer is any person who uses any goods or services, and these goods or services are for the uh, not used for the manufacturing or resale. He uses them for himself. That person is the consumer. And any person who hires or avails any service for a consideration is also a consumer. So a consumer is a person who is the end user of any goods or services, and these goods or services are not used for the manufacture or resale. Now, what is a complaint? When the consumer finds any fault with the products or the services that he has received, he is abided to put a complaint. So what is a complaint? A complaint is any allegation that is in writing made by the complainant for obtaining any relief provided by or under this act. An unfair contract or unfair trade practice or a restrictive trade practice has been adopted by any trader or service provider. When does this person file a complaint? Here are some points. There may be an unfair contract or an unfair trade practice. The goods brought by him or agreed to be bought by him suffer from one or more defects, and the services that hired or availed of or agreed to be hired or availed of him by suffer from any deficiency. In these cases, a person may file a complaint. A trader or a service provider, as the case may be, may have charged for the goods or the services mentioned in the complaint a price in excess of the price. Many a times we see that the goods or the services are sold or given at a much higher price. That time of complaint may be filed, and many times we also see that the goods or the services provided may prove to be hazardous to the life and the safety when used by the public. So a claim for product liability action lies against the product manufacturer, product services as the case may be. In these cases, a claim for product liability is put up. Who is a complainant? One who files the complaint is a complainant. Now, who may be a complainant? A consumer or any voluntary consumer associated, registered under any law for the time being in force, or the central government or any state government itself, the central authority, or one or more consumers, where there are numerous consumers having the same interest, or in case of death of a consumer, his legal heir or legal representative. In case of a consumer who is a minor, his parent or a legal guardian may file a complaint. So any person who files a complaint is a complainant. And this may be the government itself or the central authority itself. Now, what are the consumer rights? The consumer has mainly 8 rights. These rights are, I'll discuss the rights one by one. The right to be protected against the marketing of goods, products or services which are hazardous to life and property. The right to be informed about the quality, quantity, potency, purity, standard and price of goods, products or services as the case may be, unfair trade practices. Then the right to be assured, wherever possible, to access to a variety of goods, products or services at competitive prices. The right to be heard and to be assured that consumers' interests will receive due consideration at an appropriate time. The right to seek redressal against unfair trade practice or restrictive trade practice on unscrupulous exploitation of the consumer. The right to consumer and awareness. And for this very purposes, for providing the consumer rights, this Consumer Protection Act have been formed. Now, what is the product liability? It is the responsibility of a product manufacturer or a product seller of any product or service to compensate for any harm caused by a consumer by such defective product manufactured or sold, or by deficiency in services relating thereto. So the responsibility of any harm that has been produced to the consumer because of the fault of the person who is producing this product or giving any type of service is comes under the product liability, and the consumer can file a complaint against these authorities, against the manufacturer or the person who has promised to give some services. But then a product liability action. It is a complaint filed by a person before a district commission or state commission or national commission, as the case may be, for claiming compensation for the harm caused to him. The consumer can claim compensation for the harm that has been caused to him, and this is addressed by the district commission or the state commission, sometimes the national commission or the central commission. Now, there are various protection council to safeguard the rights of the consumer. These councils have been made so that law and order be maintained, and the consumers can have a platform where they can put up their complaints. They can get solutions of the problems they have been facing. So the highest is the Central Consumer Protection Council. It is formed by the central government and also known as the Central Council. The Central Council is an advisory council, and it consists of the following members. The first member is the Minister in Chief of the Department of Consumer Affairs in the central government, who shall be the chairperson. Our current chairperson is Mr. Ram Vilas Paswan, and many members of other official and non-official members presenting such interest as may be prescribed. The number of official and non-official members that keeps on varying according to the need. Next, under the Central Consumer Protection Council, we have the State Consumer Protection Council in each of the state. It has the following members: the minister in charge of consumer affairs in the state government, who shall be the chairperson, and such members of other official or non-official members representing such interests as may be prescribed. Such number of other official or non-official members not exceeding 10 as nominated by the central government. In the State Consumer Protection Council, a certain number of members are nominated by the central government. Next, under the State Government Council, there are District Consumer Protection Councils in each and every district. It consists of the following members: the collector of the district or whatever the person is named in that particular district, who shall be the chairperson, and many other official and non-official members representing such interests as may be prescribed. So, whenever a dispute is seen, meetings are held by the central council, sometimes the state council and the district council as the need may arise. But there is a law that at least one meeting of the central council in each year has to be held, and 2 meetings each of the state council and district council in each year has to be done. Now the objective. What is the objective of this various councils? The objectives of these councils is the promotion and protection of the consumer rights under this act. So these councils look into the consumer rights and sees that if all the measures are properly maintained. So then next, moving on to the Consumer Protection Act in the medical field. This is our main topic of discussion. So we all know that the doctor-patient relation mainly relies on mutual trust and conviction. However, we have seen that over the years, owing to commercialization of the healthcare and the healthcare and various healthcare or medical professions, the profession has run out of faith. And we have seen that many type of discrepancies and lack of medical awareness, sometimes medical negligence has led to many mishaps. So this Consumer Protection Act has been now bestowed on the medical field so that the patients, sometimes also the doctors, are protected from any type of malpractice. The Central Protection Act provides a forum to safeguard the rights of the customers and establishes guidelines for the speedy redress of their grievances against unethical medical practices. Here, all the services that are rendered to a patient by a medical practitioner is covered under Consumer Protection Act, except when the service is provided free of cost, especially in charitable dispensaries and hospitals and primary healthcare centers. So we have to keep in mind that all the services that are provided by the medical practitioners come under the Consumer Protection Act, but the services that are provided for free and also in the primary healthcare centers, they do not come under this Consumer Protection Act. This law is not enforced to penalize all healthcare professionals that cause injury to the patients, but is concerned only with medical negligent acts. If a patient or the relations of a patient feel that suffering or death of a patient is because of negligence of either the concerned doctor or the health facility, they can complain to the Medical Council of India or to the Consumer Court. This act covers all medical practitioners and is not limited to only allopathic practitioners. So we as homeopaths should also be very careful, because we also fall into this category. And any type of medical negligence that will be proved in court will proved to be problematic to us. Now, who is the consumer in medical practice? As I have said before, a consumer is a patient since we are providing a service to them. So, a consumer is any patient who pays to get services from a doctor or a hospital, and any person who pays for the patient or a legal heir or a representative of the patient, spouse, parents, children of the patient. So, these are all consumers in our medical practice. Now, what is a doctor-patient relationship? It is very important to keep in mind a doctor-patient relationship. A patient or guardian has full power of selecting his doctor or hospital. He is not under any compulsion. A doctor is also paid remuneration and steps into the shoes of an employee during the period he gives treatment or performs any type of operation. The patient or guardian have the right to reject the services of the doctor or hospital any moment they feel that they are not satisfied or they have found a better alternative, and for this they do not have to give any reason to the doctor, concerned doctor or the hospital. The medical professionals strongly feel that the relationship between the doctor and patient is that of contract of personal service. But in the Consumer Protection Act, it has been written that this is a contract of service. Here they consider the patient to be the master and themselves as servants, with the exception that the doctors are bestowed with professional skill to serve the master. The master is here the human body. They do not deny the accountability, nor they deny the existence of erring hospital, deviant doctors and malpractice, but the percentage here is too small to give the dagger in the hands of the general public, so that they can run behind the doctors. This is done because there is a certain amount of restriction of the doctor. A doctor cannot have a full control over his patient. His duty is only to advise the patient to give all the treatments that he feels is best for the patient, but he cannot fully control his patient, and this many times leads to failure of treatment. We do not get fruitful result from the treatment. The cases may be such as when the patient comes to the doctor at the terminal stage of his illness, patient comes without any previous medical records of treatments undergoing. Patient may be hiding some facts from the doctor. The patients may avoid taking the prescribed medicines. Patient may not follow the advised diet and regimen. The doctor can only prescribe, only advise him, but he cannot look into the matter that he is doing the each and everything that has been advised, nor he can get the full history of the patient, because many a times it is seen that the patients lie, and in these cases there is failure. Often it is also seen that the prescribed medicines that are to be taken at correct intervals, they are missed. Many a times follow up, which is the cardinal component of medical management, that may be delayed and the patient may not come at all. Patient may resort to some types of magic or faith healing, as is seen in the rural areas. And also many times the patient, it is seen owing to the huge cost, the patient refuse the investigations, and without the investigation it is not possible for a doctor to give the correct management. So in these cases we do not get the fruitful results of our treatment. So what is the medical negligence under consumer forum? Only medical negligence is punishable under the consumer forum. An aggrieved person can approach the consumer court to file a case against the accused doctor and the hospital. The person can claim for damages due to medical negligence against a doctor or a hospital. The time limit with which a complaint for medical negligence must be filed is 2 years from the date of injury. So, beyond these 2 years, this case will not be taken up. So, from this, what conclusion can we draw? So, the doctors here, we cannot guarantee a diagnosis. We may rather give a differential diagnosis or a probable diagnosis on which our treatment is based. Doctors also cannot guarantee the cure. He makes his best efforts because he knows that much more than anything else, his professional reputation is at stake. So, it is very common that each and every doctor tries his best to serve his patients. And the patients, while in pain, approach the doctors for their treatment with a simple hope of speedy recovery. However, sometimes there are situations where the treatment does not go as planned. It may be because the result of a natural course of life or due to the doctor's fault. One thing must always be kept in mind that even we doctors are humans and prone to making mistakes. However, any harm due to the negligent act on part of the doctor or the medical staff shall attract liability. So, carefulness is a must. With the advent of the Consumer Protection Act, there is better protection for those who pay for their medical services. But the two categories remain excluded. Which two categories remain excluded? Those who have denied services and those who cannot pay for the medical services. This act, it was resented by the community of doctors for various reasons, like unwillingness of the doctor to take up high risk cases or emergency cases for the fear of being dragged to the court. Now, when this Consumer Protection Act came up, the medical fraternity first tried to resent this act because there were various good reasons for the resenting the act. First was the doctors began to worry that if the treatment did not bring about fruitful result, he would be harassed in court. Nobody wanted to be defamed, so they were. It might be the case that is not taking up the high risk cases or the emergency cases, and ultimately here the patient would have to suffer. Now, to keep the doctor safe in safe side, the doctor had to give a lot of investigations, and these investigations are had to be borne by the patients. So it is probable that the patients who are not economically very stable, they had to suffer. Next, the function of the doctor is noble and service oriented one, and it is equated with that of traders solely aiming at profit motive. So this was a kind of disrespect to the doctors, that a doctor was compared to a trader, and we not only always think of profiting from the patients. Our first and foremost aim is to give the patient some sort of relief, to cure the patient. So this was type of this. That's why this was objected by the doctors. And then the absence of doctors in the administrative bodies can result in some erratic decisions. Now these administrative bodies, they do not have any doctors, and sometimes the decision they can prove to be erratic or not completely correct. So this was another drawback. Doctors, on the other hand, have a legitimate grudge. When a complaint is taken on file, it may receive publicity, tarnishing the reputation of the doctor concerned, even if the complaint ultimately fails. Many times the cases that are put on the consumer courts, they fail. But the reputation that has been lost by the doctor is not restored. So this is another drawback. Next, from all this discussion, what takeaway message should we have? Apart from the treatment, a doctor has to inform the patient. The information should be adequate and not cursory. A doctor should very well inform the patient. He should inform the patient in a language that the patient understands, not use some mere big medical terms that is not understandable to the patient. He should make the patient understand what is the disease, what is the prognosis of the disease, what sort of treatment can be given, what are the, if more than one treatment option are available, what are they, what is its length, the risk, the success rate, the side effects, cost, everything has to be explained to the patient and the patient party. Now the doctor is again bound to give all information that is asked for. Being laymen, the patient party or the patient may ask many type of questions that they do not understand, that they need to understand, and this all information shall be given by the doctor. He should make the patient aware of the natural course of the illness if the patient is left untreated. And apart from the information part, sometimes consent is to be taken. This consent taking is very important. This consent should be in a language that is known to the patient and is legibly filled. This consent is most valuable when it is taken in written. So whenever a patient comes to us, is under our treatment with some serious issues and that may lead to death of the patient, that may lead to some serious type of handicapture or anything, that should be duly made understood to the patient, and a consent should be written and signed. And the most important is case sheets. The case sheet should be maintained very efficiently. So whenever we are put in any type of question, or whenever we are put before the law, we can prove our part, that treatment was given as was needed and everything that was possible was done to treat and cure the patient. With this, I end my presentation and I thank you all for your patient hearing. I especially thank Dr. Avijit C. Burman, my mentor, who has helped me a lot in preparing this topic, and also Dr. Bidyut sir, who has given me such a huge platform to give this presentation. Thank you all of you.
Sanjukta, to be very honest, I could not rather help Sanjukta a lot for this for the preparation of our lecture today. As I was extremely busy with the university examinations all throughout this week, a tiring procedure was going on. Our students of National Institute of Homoeopathy were appearing for their second BHMS examination. For that reason, it took a very long period of time. That's why I was totally I was not at all. I could not find rather any time, rather help Sanjukta to her satisfaction, but just simply few points, or rather I should tell you, I should show you one book where from you all we should keep this book in your custody, in your chamber, in your clinic. These books are the different acts, books on the different acts in forensic medicine and toxicology. all the departments are bound. It is the guidelines of CCH. All the departments, all the colleges are bound to keep these books, the act, different books on different acts. These are published by Common Law House. This book is published by Common Law House. The book name of the book is Consumer Protection Act 1986 with West Bengal Consumer Protection Rules 1987. This was published in 2014. I have this copy, but later on some editions have been made. Not much of changes have happened, but this you should keep it in your custody, in your own clinic or residence, published by Kamal Law House. And this is a very relevant one, so that you can go through the different pages of these books. Otherwise, in the internet, you can search it out and find out the different points which are to be kept in mind. Now, coming to Sanjukta's today's lecture, yes, this is very pertinent enough and a need of the day at present. We are not in a very smooth selling time period. Doctors are facing, those who are in private practice or their own clinics practicing, they are really in trouble at certain point of times. They face a lot of troubles at certain point of times, but we are lucky enough, practitioners from the advanced practitioner for the modern medicine, rather not the advanced modern medicine, they face more troubles rather than us. But we also at certain point of times, mostly due to our own negligence, we face different sorts of troubles. Sanjukta has clearly pointed out very legitimate, very lucidly, very distinctly, and very clearly. She had pointed out regarding the doctor-patient. She has emphasized regarding the doctor-patient relationship. This is to be kept in mind always with the maximum importance. Who is a consumer? Who is a complaint? What is a complaint? Who is a complainant? Etc. Etc. The rights of the consumers. There are 8 numbers. The different protection councils, the State Consumer Protection Council, under that the District Consumer Protection Council. Why we are discussing these things? Because the complaint may come against us, but at certain point of time, we may be also a complainant against another person. That's why it should be known to us also. We are also always we are consumer. We are purchasing something, some services, some goods, etc., etc. In that case, if I am not satisfied, I can lodge a complaint. Where to lodge a complaint? In the State Consumer Protection Council or to the District Consumer Protection Council. Then coming to the CPA in medical field, she has clearly mentioned consumer protection and pertaining to the persons of medical fraternity. Here, it is only the medical negligence which is very important and which has to be kept in mind by all of us. And regarding this, again, I want to highlight few points what already Aniruddha and Sanjukta, both of them have covered, but still for your kind notice and for your information, I want to highlight certain points. One of those is unnecessary investigation. Going for or advising your patient investigations which are not required may lead to different complaints lodged by the patients. In this case, I want to tell you that many doctors have preferences, or most of us have preferences over specific laboratories. Definitely, all the laboratories are of not same equal quality. They differ. The qualities differ. There's no doubt about that. But we should be very careful when advising our patient not to specify the name of any specific laboratory where from the investigations to be done, because patients as a whole, they have a most of the patients, they have a clear idea that doctors are getting commission from the laboratories, and for that reason my doctor is referring me to that particular laboratory. This should not be. The patient should not think in that line. In that case, always your advice will be, you are supposed, I am advising you to go for this, do these tests. These are very important. Patients nowadays ask why this is required, why you are asking this, why you are asking that. You please try to explain. Don't be impatient. Very cool and calm, with a very cool and calm temperament. Please try to explain the patient why you are advising this test to be done. This is required for his or her treatment. For her benefit or for his benefit, you are advising the patient for doing this investigation. And while the name of the, be careful not to mention the name of a specific laboratory where from that should be done. Patients sometimes insist, Anna Boliana, please mention where from I can get it done. In that case, when the patient is repeatedly insisting on asking the names of specific laboratories, please do not mention only one name. Try to mention at least 2, 3, 4 names of reputed laboratories in and around you. In and around you means at least within in the case where the patient can go easily 2, 3, 4, 5 kilometers within that diameter radius. Please try to mention names of at least a number of laboratories where from the patient can choose and go and do his or her tests. This is important. Unless the patient insists, do not out of your own, do not mention the name of a specific laboratory. That may lead to unnecessary problems. This is one. And uh, prognosis, Sanjukta has mentioned, prognosis, diagnosis, treatment options. These are very important. What are the treatment options in this case? Please try to explain to the patients in brief, not in detail. What are the treatment options? What is your disease? What the disease is? Patients are not aware regarding, all the patients are not aware. Not everybody is searching in the net. So patients might not be aware regarding the disease and the prognosis. What may be the consequences in the near future? Please try to mention and explain the things to the patient and the patient party. And in specific cases where the case in your understanding, if the patient or the case or the disease is not a favorable one, may be a problematic one in the coming days, you please mention on the left hand side prognosis, explain to the patient and the party. In cases of problematic cases, in cases of emergency cases, serious cases, do not forget to write this line on the left hand side. Prognosis explained. On the right hand side, you have mentioned the diagnosis, either the probable diagnosis or the confirmatory diagnosis. On the left hand side, please mention this thing. Prognosis explained to the patient and party. This will save you. A legitimate prescription, a valid prescription containing everything what Dr. Aniruddha had mentioned. Please try to maintain these things. This may take 5 minutes extra time, but under unfavorable conditions, if anything, by chance a case is lodged against you, a dissatisfied patient lodges a case, in that case you will be saved by your valid prescription. And not only the valid prescription, please, as Dr. Sanjukta has mentioned, please maintain the case record. Do not do the case taking. The case taking is not the property of the patient. I repeat, I always tell my students, case taking, you are doing a case taking, a thorough case taking, wasting 1 hour of time, 1.5 hour time, a meticulous case taking has been done. Please do not share it, do not hand it over to the patient. This may be misused by the patient. Many patients misuse this. I am not going to the details how that is misused, but please keep it in mind. Case taking is not the property of the patient. It is your own property. Maintain yourself. Keep it under your own safe custody. And if required, please produce it. If required, asked by the court, please produce it. Please produce it, and that will save you. And lastly, but not the least, earning name and fame is very difficult, but defamation is very easy. You may take years of time to attain a name and fame, but a single case may defame you, and that defamation creates lot of problems in your future. It just puts a stigma on your back that this doctor was involved in such and so case. He or she has been penalized by the court or the medical council, etc., etc. And this spreads like anything. And please be careful regarding all these things. What our speakers of today, Dr. Aniruddha and Dr. Sanjukta Mandal, they have told you, they have explained in detail, thoroughly and categorically. Please maintain all these things. I'm sorry, again, sorry to say, we homeopaths do not maintain all these things. We forget. We had learned this thing in our studentship. Our teachers, our gurus had taught these things, but we fail to maintain these things during our clinical own practice. Try to make it a habit, and from now onwards maintain all these things so that you do not fall in trouble in the days to come. Thank you once again to our speakers, Dr. Aniruddha Nag and Dr. Sanjukta Mandal, for giving us such nice presentations in this webinar. I am thankful to the organizers, especially Dr. Narayan Kalyani, Dr. Bidyut Mukherjee, his able son, going to be a budding doctor, Dr. Mr. Aku Mukherjee, and my very dear friend, Dr. Prahlad Sharma, and others, for continuing this online CME for such a long time. And hope um, in the coming days also, we will be fortunate enough to hear, and we will fortunate enough to share our views with you also in other some in the coming days with some other topics on forensic medicine and medical legal aspects. Thank you once again, all of you. Good night to all of you. Thank you. Over to Dr. Bidyut Mukherjee and Orko.
Thank you, Dr. Avijit, and both the speakers tonight. It's a excellent learning session.
I'm sorry to interrupt
Uh,
once again. Sorry to interrupt in between. But we have one winner with us with the quiz competition. I hope
right,
his
right.
internet
Please
was.
announce the winner. Announce the winner and bring the
It's
speakers on the screen.
okay. It's Shoaib Ahmed from from Bindapur Homeopathic Medical College. Let me just bring up everyone on screen first. Then
Uh, Congratulations, Shoaib, for being here in the show. Shoaib, are you in?
hold on a minute. I'm taking him. Yes.
Shoaib, what's your question and to which speaker you want to ask? Shoaib, can you hear us? Shoaib,
He's not audible.
we can't hear you, Shoaib. স্পিকারটা খুলে বলো, মানে হেডফোনটা খুলে বলো, মোবাইলে ডাইরেক্ট আসবে।
শোয়েব, তোমার মাইক্রোফোনটা মিউট হয়ে রয়েছে, ওটাকে অন করো, আনমিউট করো, কিছু শোনা যাচ্ছে না।
না শোয়েব, শোনা যাচ্ছে না। Shoaib, if you can write your question in the chat box, we'll take up the question to our respected moderator and the speakers tonight. Dr. Avijit, there is a question already sent to you in the WhatsApp. First, let me see what Shoaib is having his question. It's from Dr. Ujjwal Mondol. Professor Avijit, if you can check your WhatsApp, there is a question over there.
I'm checking.
Okay, in between, the Orko is trying to get Shoaib's question on screen if he can. Orko, if you can get Shoaib's question. Yeah, the question is shown on the
If he
screen now.
comes up, if he comes up, I will take him up on screen and will let you know in the private chats. Please just follow the private chats if possible. Thank
Okay,
you.
sure. Avijit, did you get the question on the screen? There is particular form oblique format for issuing death certificate. Private practitioner should follow the same.
Huh. I have seen it, Dr. Bidyut.
Yeah, please.
Uh, Dr. Ujjwal Mondola asked whether to follow the prescribed format for issuing death certificate in case of private practitioners. Should follow the same. Yes, if my answer is yes, if you can follow that format, that is best. No doubt about it. But there is a flexibility in it. There is a flexibility in it. You can change the language to some extent of your in your wish, according to your wish, but the points must be there. I repeat, the points cannot be changed. Points means first on the top, to whom it may concern. Next is the identification part: name, age, sex, guardian's name, address. This is the identification part. Next, the patient suffering from, that means the primary cause of death. What were the diseases by which the patient was suffering from? This, then the date of death, time of death, place of death. Okay, these points should be mentioned in your format. That should not be cannot be changed. Uh, and lastly, died at what time and due to neurocardiorespiratory failure. Again, I am repeating the same format. If you can use or write in that same format, that is the best. But you have the privilege to change or modify a little bit in the language only. That can be used in your own language, but the points must be there. Those cannot be changed. वो addition भी हो नहीं सकेगा and minus or cannot be subtracted even. Not a single point can be added, neither nor it can be subtracted. Okay, thank you. Am I clear?
Thank you so much. Thank you. And this, I am really, on behalf of NIH Alumni Association, we all are indebted to Dr. Avijit, Dr. Aniruddha, and Dr. Sanjukta, because in a very short notice, you had made a documentary. It will be there in the YouTube channel as a referral text for all homeopaths. Now I'll request our respected sir, Dr. Narayan Kalyani, sir, to give your speech, please.
Thank you, Bidyut. Many thanks to all participant viewers, listeners, everybody. Special thanks to Akashbonti Sonowal. She is participating from Dept, from such a distance. We are very happy. Madam, please come and encourage us. Ask your friends to join and to encourage all of us. Many thanks, madam. Then special thanks, and we are really grateful to Professor Avijit Burman for his beautiful, excellent moderation, along with his serious experiences and advices. Our today's speaker, brilliant speakers, Aniruddha Nag and Sanjukta Mandal, brilliant presentation. I must say all of us has learned many things. We will try to follow it for our own safety. Many thanks. Just little I want to add one thing which was taught by our teachers. He was given one example. Our teachers he was basically one eye specialist, Dr. A.S.R. Chatterjee in Calcutta Homoeopathy Medical College. So one day he came in the class, he was taking jurisprudence classes. So one day he came and told that one doctor was called by the court with a notification that 7 years before he gave one person certificate of sickness, bed rest, and he was accused of murder. So he have been accused of conspiracy of murder. Just imagine, a doctor was accused by the court for conspiracy of murder of a fact of 7 years before. Then after hunting, he got the information that certificate was his, and there it was mentioned patient was suffering from infective jaundice, infective hepatitis. He was asked bed rest. Then later it was proved by the Home Department, Police Department, that during that period he attempted murder and he was accused of, that was proved. Now then, where lies the problem? Somehow doctor escaped, and our teacher, Dr. S.R. Chatterjee, he was requested to help. He helped and he was saved. Doctor was saved. Thing is that very often we are asked to give sick certificate. But brothers and sisters, do never put the word bed rest until you are 100% confirmed that patient is not able to move from the bed. Simply put rest. And rest of the things we have learned from the CME, be very, very cautious to write bed rest, because if you write a bed rest and any crime is done during that period, you will be accused of conspiracy of murder or conspiracy of any bad incidences. This is one very serious precaution I told you. So, very commonly given. Dr. Burman is willing to add something. Please, Burman.
Extremely thankful, Dr. Devnaran Kalyani sir. I had missed out this word. I had missed
Okay.
out this word. This was definitely to be mentioned while advising rest. Never to use the term bed rest. Never, never, never to use the term bed rest. Only rest. Whatever, where he will take rest, in the terrace or in the footpath or in the roadside or in his own room, that is his or her own discretion. I cannot, I should not advise bed rest to my patients. This is one. And the second thing which I had missed out, it came in mind, please don't give any commitment of cure to your patient. Never, never commit a cure to your patient. Patient will insist, ঠিক হয়ে যায়গা তো, ঠিক করে যাবে তো, ছেড়ে যাবো তো, I'll be cured. Please don't give this commitment. Assure your patient that yes, this is curable. We can do it. Homeopathy has effective treatment in this disease. I will try my level best. I will try my level best but don't, you can tell that you will definitely will be better, but don't give any assurance regarding cure. This is a blunder mistake. Sometimes we tell, yes, apni chhede jaben, you will be cured. This may drag you to the court. So these 2 points to add. Thank you, Dr. Kalyani sir, for just pointing out. I had missed out this point. Thank you so much once again.
So thank you, Sri Burman. Another one point I just want to add, Dr. Sri Burman, that one patient are asking that, sir, should I be cured? Then we should not say, yes, he will be cured, but we can encourage the patient that these cases are curable cases, so far I know. But you and myself will be able to assess your curability and probability after after a few days or few months of time. If a case is chronic cases, you can ask them after 2 or 3 months. After the next report of progress is within our hand, means the next test is done, we have to wait for clinical improvement and improvement in investigations. After a little bit time, after a few days of my treatment, I'll be able to tell you whether we are curable or improvable or what is the fate or prognosis of the case. So in that way, we can encourage the patient to wait to continue the treatment by telling that everything you'll be able to understand after a few days or few weeks of time after the next investigation report is in our hand. That will help the patient, and that will show your confidence regarding the disease and treatment before the patient. Anyway, many, many thanks, everybody. Brilliant presentation and really effective CME for this 52nd CME online. And we are very, very grateful to all the teachers of NIH for helping us very lot sincerely from very beginning by encouraging all of their products. We are all products of our teachers of NIH. So it's a very brilliant bridge between the teachers and the student forever. We will try to maintain, and I request on behalf of the Alumni Association to all the speakers and viewers, please refer the names and telephone numbers of good speakers to us. We will contact them. We will do everything. Please let us know who can provide us their information and experiences for all of us. Thank you. Thank you very much. Thank you.
Thank you.
Good day.
Uh, Nevertheless, just once again, I want to pay my respectful homage to my teachers whose teachings, starting from Professor Robin Basu, Robin Kormukar, so on, and none other than the Guru of Gurus, late Professor Jagat Bandhu Mukherjee, Professor J.B. Mukherjee sir, who
Okay.
taught me in this field, and on whose teachings I am just carrying on for 25 long years in NIH, and I'm just transmitting what they had taught to my students in the days to come. Yes, I'll try my level best to render justice to this fraternity. Thank you once again to all of you. Thank you,
So let
Aniruddha.
me let me say a little bit more in contrast of Dr. Burman's teaching, teachers teaching. Our teacher was J. Bose. He was to teach jurisprudence. So what he used to do, he will come in the late hours of the day at 3 or 4 last class, and he will go on telling one story, a beautiful story of criminal case. After that, he will start the class. So the class, to make this type of classes very interesting, the presentation of cases are very, very interesting. We used to be silent even after the exhaustive classes of the whole day to listen Dr. Bose's class, J. Bose. So it's a very nice thing. If you see and listen the cases of this type of medical legal incidences, you will get a special interest on medical legal aspects of medical science. Thank you. Special
Thank you,
special thanks
sir.
to Shee Burman.
Thank you, sir. Now I'll request for a very important and very exciting announcement. I'll request our beloved Dr. Pralay Sharma to come up.
Thank you so much. Good evening. Thank you, Dr. Mukherjee, our Secretary of Alumni Association, our President, Dr. D.N. Kalyani, sir. And we have been here and listening this webinar platform today for 2 hours 17 minutes right now. We have gone through the excellent moderation by our very dear friend, Dr. Avijit Burman. And we are very proud that our students, they have given their lectures in the specific subject today. We have with us Dr. Akashbonti Sonowal, Dr. Sanjukta, Dr. Aniruddha, and we are very happy to spend this evening with them. I am here today to speak about a very specific reason. I am here today to say a specific purpose today, and would like to declare that our alumni association, by number, it's around 2,700 right now, the participants, the members. Thus, our alumni association is a very strong organization today, and this organization will organize a reunion after many years, because of we have not organized the reunion because of the COVID scenario. This year, if situation permits, if COVID does not spread away like previous years, we have decided that we will host the alumni meet this year in 2022 on 9th of December of 2022 for a single day. And as you all know, the 10th December is our foundation day of the institution. So we can enjoy both of the day, but the reunion will be on 9th of December 2022. And we have done our preparedness meeting in 2 episodes, and the last episode was today at 6 o'clock. We've been in the webinar where there was a spontaneous participation of the alumni, and we have seen that around 40 numbers of the participants who volunteered themselves to be in the webinar today in this evening. And I believe that this year, this alumni meet will be a grand one. We have also planned that we will invite our honorable minister, cabinet minister, as well as the minister of state to inaugurate the program of alumni association in the alumni meet. And we have requested the participants of today, what we have discussed, that the alumnus means we have alumnus from DPNH course, from BHMS course, from the MD course, and we have informed them, we have asked them, we have requested them to spread this message in their WhatsApp own or WhatsApp group, batch wise WhatsApp group, as a awareness campaign or the sensitization campaign, so that we get a large number of participants. I believe that you all, whoever have completed their course from the institution, they will spontaneously join this alumni meet, and it will be a grand success from our part as the organizer. I assure you, and I believe that if you once come to the institution, you are coming to your own house. We are there, we'll take care of you. And this was from my part. Once again, I thank all of you. And in anticipation, I thank all the honorable members, all honorable alumnus of our institution, that they will participate, and this we will enjoy there, and the alumni meet will be a grand one this year. Thank you so much. Thank you, everyone.
Thank you, Pralay, and that's a very grand declaration on behalf of our NH Alumni Association, and those who are viewing it tonight and will be viewing it in the coming days. Get ready, get your packages ready for the 9th of December for the Grand Meet, 9th, 10th, followed by 11th, a Sunday, which everyone can enjoy with your batch, or you can have your sights in together. And sir, with your permission, Kalyani sir, with your permission, let us
Sure.
return back to Orko for
Sure.
closing and give your setup. Back to the
Sure,
backstage
definitely.
editor,
Thank you.
Orko Mukherjee.
Good night to all of you.
Thank you all. Thank you, sir. And with this, we are going to end this CME. And as per, since I think you are from the first, so let me just tell you about the join button. So, what is about this join button thing? So, it is a fourth type of membership program. This is a channel membership program where you will get premium quality contents and etc. things depending on the plan. And by clicking on that, there is an intro video where I have given a little details about welcoming you all in the membership plan, like that too. And in this upcoming days, I will make a video on that too. And let me just tell you a rough idea about this channel membership. So, what is this channel membership all about? Here, there are four levels, starting from it's a just rupees type, and it's starting from rupees 29 and ending till rupees 119. So it is totally based on the fact that we are giving perks to all the members, like whosoever takes the membership. And one more thing, in every plan there is a criteria, means what to say, there is some uh, what is the term? There is some great possibilities that you will get, means liabilities you will get as a member. Like for example, let me just tell you about the basic plan, which is of rupees 29. You will just get a priority comment, means your comment will be taken as a prioritized version and it will be shown on top of every video. And with this, the main thing is that I will make a different video, a separate video on this. But just a little bit, I'm just telling it because It's totally night now. So you will get as per you have to register monthly on that plan. You can upgrade the plan from 29 to 59, and then you can also upgrade from 89 or just directly take 119. So as per you take and the month you are taking, you will be getting a loyalty badge. Like the starters get as the badge of beginner with the NIH channel logo down on it. So you will get a logo, and on this live chat, your comments will be prioritized, means at the top priority level, and it will be shown at the top of the screen on the live chat bar. And also, you will get more priorities on other basic plans, which will be covered in video, which I will upload in this coming days. So this was it. And to get any further details and information about other other CMEs or uploaded CMEs or upcoming CMEs, if you want to get notification about that and the registration process, all you have to do is just join the Telegram channel. The link is in the description. Just join over there, join the Telegram channel, and you will be getting all the updates on what is going on in NIS Alumni Association and also what is going on with other alumni and also upcoming CMEs and other updates related to homeopathy. So, with this, follow us on Facebook, like us on Facebook, follow us on Instagram and Twitter. And it's me, Medicolegal Mukherjee, signing off. Goodbye. And it's time for post CME session. So with this, good night to all and wish you a very good night again.